Have you been looking for NP jobs, like toying with the idea of private practice? Might want to dive your toes in there. But since you've only ever worked in giant hospitals, you're just kind of like unsure of how that entire world operates. If so, friend, you are me from like 4 years ago. But since you are you and you are job hunting today, you have the advantage of learning from my mistakes and my triumphs. There were some of those. They're all our mistakes too. So go you. Today I will be telling you all about the good, the bad, and the ugly of working in a private practice as a nurse practitioner. And I'll give you some helpful questions that you should definitely ask during your interview at a private practice in order to avoid making some of the mistakes I said I previously mentioned. Because as much as you are interviewing, as they're interviewing you in these situations, you really are also interviewing them. Hello there, I'm Liz. I am a family nurse practitioner who worked in private practice family medicine for the first 3 years of being an FNP. And oh boy, I had no idea what I was getting myself into. I left my very large healthcare system and wandered into a very small private practice. And by small, friends, I mean small. It was just me, the physician who owned the practice, and 2 MAs. Oh, and a part-time biller who somehow was both always nice to me, like even though I was her literal actual nightmare. Because I did not know what I was doing. So if you're watching this, thanks, Sherry. You are a unicorn of a human and I miss you. Back on track. Basically, private practice was like an alien world to me. It has some super cool things about it, but also there were definitely things that I wish I had known before arriving in that destination. So let's jump in. So if you've been around my channel for a while, you know that I am not like a stay within the lines type of a human. And private practice actually works really, really well for that type of human. There are less rules, there's less standardization and less staff. Things are less like, this is how it is across the board. But there also, this means that there are fewer resources and you are going to have to figure out a lot more things on your own. And you don't always have like a given standardized method for doing something. Or like when coronavirus broke out, there was no one to make up the new telehealth rules for us. We had to like figure it out on our own. So what can that kind of look like in practice? Well, for example, we didn't have access to UpToDate in our office, something that I like super naively thought every office came with, because everywhere I had precepted and where I had worked, they bought the access for it. But as it turns out, not everyone pays for their employees to have it because it's super expensive. We didn't have in-house like any labs for blood draws. We didn't have tech support or any like social workers or other support networks that come with larger institutions and big health systems. We did not have a nurse to call patients back and help with refills and paperwork. But at the same time, on the flip side of that, there was no like shadowy administration figures standing over my shoulder, making sure that I charted the correct way and that I had clicked every single button. There was no micromanagement. It was just like a little bit more open. And my night shift heart, my night shift nurse heart was particularly pleased with that. Another benefit that I found was my understanding of like nuanced practice was immensely expanded. I was exposed to treatment plans that may not have been like textbook, but they were super tailored to meet our population where they were and were informed by my colleague who had had decades of experience with this exact patient population. Most patients didn't have a ton of access to healthcare despite having insurance because of their high deductible plans or because their insurance like literally denied everything that we wanted to do. Here's a shameless plug for my series diving into how broken our healthcare system is so we can understand it and fix it. You can go watch that down below after this. But it was really cool to see how my collaborating physician worked around all of the obstacles of insurance and just like not being able to afford things in order to meet the needs of her patients. Something that is incredibly difficult to do in a larger system where they keep care very uniform and standardized, and they kind of tell you like, if this happens, then do this, and if this, then that. I also had a ton of autonomy and freedom, which was awesome, but the office was still really close-knit of an environment due to how small it was. And I had a lot of like go fly free and do your thing, little birdie. But I was also very supported and I could ask a ton of questions and I didn't just feel like a body to fill my chair. You know, I felt valuable as a team member. I felt that I couldn't be easily replaced. And that is huge for how feeling just like empowered and, you know, encouraged at your job. Healthcare can sometimes like swallow you up whole and chew you up and spit you out. And, you know, you feel like, oh, I was just a number. And I never felt like that working in private practice. Additionally, I had some flexibility when it came to scheduling patients, and that's something you rarely see in larger healthcare systems. You know, if I needed a longer appointment and I knew that ahead of time, I could often coordinate it so we had like just a little bit of extra time with that patient. If you had that in a larger institution, like that just sucks to be you know, take your 15 minutes and be happy with it. Bye, get another human in the door. Now, let me remind you that not all private practices are the same. And you can't simply jump in assuming that what I've just described will be your experience. So you'll have to use your interview in order to find out if the practice is right for you. So let me give you some tips on how to do that. In order to get an idea of the practice owner and what kind of collaborating physician they might be if you live in a state that requires that, you can ask the following questions like, why did you go into private practice? What do you love about private practice? And what challenges do you find yourself facing working in private practice, especially in a healthcare world that is very quickly migrating to like all the large healthcare systems buying out and gobbling up the little small business family-owned practices. Also, always shadow. Like no matter what comes up in your interview, you're going to want to shadow for at least 2 days. The first day they're going to put on like a nice show and everything's going to be fine, and then it's on day 2, friends, that the cracks start showing, and you're like, oh, okay. So definitely always shadow. But along with those interview questions, you might be thinking like, oh my gosh, that sounds very intrusive. I thought like when I interviewed that it's not okay to just ask about the difficulties of a private practice in an interview because it might make them realize there are them. But no, friends, they definitely are aware of the problems and the struggles of private practice. And it's totally okay to acknowledge that private practice is different than the huge healthcare systems out there. And they will likely have valuable insight on the differences between the two environments because they probably trained in one of those huge healthcare systems. They are very familiar with them as well. And if they start, you know, going on this rampage about how big medicine is a conspiracy and they were so bullied in the main system and no one liked their big and new ideas, well, maybe you want to look elsewhere. There might be some crazy underlying there. But if they come out and they say, great question, you know, they wanted to get to know their patients more, to have more flexibility, to be able to practice in the way that feels right to them, then that is a great conversation to have that leads you open to exploring, like, do your values align there? So assuming that the interview is going okay so far, and you have learned that the owner likes humans and actually wants to treat like them how they've always imagined that they could, and that's why they went into private practice, let us turn our eyes to kind of the nastier side of the entire business, customer service, aka the pits of hell. Because it's a private practice, the owner obviously wants to make the patients come back and has a super high vested interest in that, right? Again, in my experience, this was both like good and bad, but mostly, I don't want to say mostly bad, but it was kind of mostly bad. It was really cool to see someone care so much about their patients, especially in family medicine. And if you're looking for a private practice family med job, I can almost promise you that the person who owns it is not doing this for the money, because primary care it's not a moneymaker. We need to have a different talk about that sometime, but you do not make barely any money in primary care. If it's a specialty practice you're interviewing with, that can be a totally different story. But even so, many private practices are being bought out by huge health systems. So if you have a private practice and they're sticking it out, they probably really love what they're doing, and they probably don't want to compromise like how they practice, which can often happen if you're selling out to a larger company. And all that to say, the humans that you usually meet in private practice are typically pretty cool, pretty good humans, and they kind of have their own club, meaning they usually refer, like when we referred to endocrinologists, we referred to private practice endocrinologist. And in my case, like we all kind of knew each other. The other specialists would stop by the office. They knew the names of my kids. We could chat, and it was just nice. And then there's those private practices that just are out there for the money, and they're super corrupt, and that's why they can't be eaten up by anything else, because they're just corrupt chaos. Just run from those. But you'll see them if they offer you a lot of money, and you're like, this is a lot of money. Just ask a lot of questions. If they hand you a lot of cash, be like, why? But this kindness towards people and the need to keep their practice running, that I very much enjoyed, led to problems. The owner's income is very dependent on how many people get their care at the office, if they bring their friends, if they recommend to family, if they speak well of you in general to the community, because if those people that come there don't like you or the care that they've received, they don't come back. And it's literally money out of the owner's pockets, and word will spread through the community. In a large system, most patients are just a number on the list. And if they leave the practice, it's not like actually doing anything to the provider's not going to probably get paid less, because the healthcare system will usually absorb the loss. Also, there's a huge line of people that are going to come fill that one slot for you. This business side of things, it comes with a unique problem you'll need to navigate, like patients threatening to leave because you won't give them antibiotics for their viral cold, or because you won't prescribe them the pain medicine that they want when it's not appropriate, or because any number of things that people want or they need, because Nancy from Facebook told them that they needed it and they're here to get it and you won't give them to them. So you quickly become a customer service associate, and it gets really exhausting. People can seem very entitled sometimes, whether they mean to or not. They sometimes feel like they're doing like you and the practice a favor by coming to your small private office, and because of that, they throw around if
you don't do this, then I'm going to leave you to go to XYZ mega health system or this other private practice down the street that's super corrupt and will literally do whatever the patient asks for.
Dealing with these situations was especially hard as a employee at a private practice. I know what goes on at the big health systems too, but it's just a little bit more in private practice. Most of the time, I didn't feel right doing what the patient wanted, if it wasn't safe and what was best for them. In the practice I work at, it mostly came down to wanting antibiotics for colds. And I was told that if they really want them and it's going to be a huge sticking point, then just write it, is what I was told, because it wasn't worth losing the patient over this one thing. And this definitely is something you're going to want to discuss when you are interviewing. You can ask, what kind of decisions can I make when a patient is threatening to leave? Can I say no to their demand and stand my ground? Or will I be expected to give in if they start saying like, well, I'm just going to leave the practice and go over here? Can they demand to see the other provider? What is the nuance there? When I was with the practice I set a very firm boundary with pain medication. I said that if I didn't feel it was appropriate, I could say no and defer to the owner. But this was something that we discussed very early on. We both agreed that this was an appropriate course of action. And I did that with all controlled substances. If I didn't feel it was correct, I would not write it. But with antibiotics, I lost that fight many, many times. And it still bothers me, clearly. But moving on, this leads me to my next point. In private practice, some things are done differently and may not be completely up to date. I mentioned earlier that a perk of private practice is that you can be really innovative, safely, of course, and you can be creative with care that is truly tailored to the patient. You can do a lot more of hey, I'm pulling all my experience in this exact population, my decades of learning into this. But the downside to that is that sometimes it gets awkward when the owner of the practice, they're practicing methods that are old and they haven't updated, like doing PAPs for people before age 21. I saw that all the time. She scheduled for PAPs for younger women, and I was like, oh, we don't really do that anymore. Sometimes when you aren't given from your higher ups updated new guidelines by administration, and you're swamped by, the ins and outs of running a practice, you can miss a few things in the world of healthcare guidelines and updates. And it just is kind of like, ooh, how do we navigate that? So how can you approach that question interview? You'll probably want to ask if you will be expected to follow their practice or if you can do your own thing. My boss and I worked quite well together, and we were able to discuss practice changes easily without like awkwardness. But I imagine it would be super intimidating if that wasn't the case. If you couldn't be like, hey, so did you know that like actually this came out and now we're not supposed to do PAPs at this age? It could get rough. So it's good to iron that out early, kind of feel them out. Are they open to learning from you? Because it can be a really helpful indicator of if the job is right for you or not. If they say they just need you to do what they do and have always done, and they don't want any insight from you, they're probably not valuing you as like a provider in general, and maybe that's a huge red flag. Next, let's touch on patient panels. If you aren't familiar, a patient panel is basically the list of patients seen at your office. And if you have your own panel, you primarily see those patients. That is like your own panel. If you share a panel, that means that all the patients in the office see the same, like both providers based on who is available. And in some states with some insurances, a physician has to be the one to initially see people, and then you can kind of take over as an NP for the majority of their care. But I'm telling you, like this doesn't happen. I have not experienced this, but I've had friends that went to work at private practices and their physician just signed their notes as if they saw the patient for the first visit, but really it was the NP that did. And I've heard that very often, and it just feels yucky. So that's something to clarify, to balance, like just clarify if you live in one of those states or you're going to be working with insurance that dictates those limitations. Do they need to see them once a year? Are you considered their primary? Just something to, a little side tangent to keep in the back of your mind. I've been seeing that pop up a lot lately. But the bottom line with this is you are definitely going to want to find out if you will have your own panel or if you will share your panel with the other provider before you accept the position. In private practice, it is generally more common to share a panel. I semi-shared a panel at the practice I worked at. I had patients who primarily saw me, but everyone had to see the woman I worked with at least once a year per our agreement. And I was actually the one that initiated that policy. She was fine with me just like always seeing them. I was like, I think it's important for you to see them because it's your practice. And if I leave, they need to know you. And then I did leave, and I'm glad we had done that. And it just lets her keep better eyes on them. But I would also like be able to see new patients in the office. I saw many of her patients who came in for acute visits or routine follow-ups if they were okay with seeing me instead, and it worked better with the schedule. And we both we did a lot of like, we both saw everyone. And while this mostly worked well, it did have its own disadvantages. It worked quite well for acute visits. It's like you come in, we fix you, we ship you out. But it could get messy with like chronic follow-ups because it required us to be on the same page for long-term treatment plans. And again, since there was nuance with that, and it wasn't everything like strictly like this by the guidelines. Even within guidelines, there's like open areas. I didn't always want to go in and like mess that up. The owner was a wonderful human, also, but like note taking was not her specialty. So it could be really difficult if she didn't write in her treatment plan, like, here's the backup plan if this doesn't work, or like, here's the plan going forward. So sometimes it felt like when they came in for appointments and I saw patients she was primarily managing, I was just kind of like passing them on until the next appointment without doing much because I wasn't sure of the plan and I didn't want to mess it up and interject something different. Obviously, if something came up, then we addressed it. But the solution I came up with that, if you need to implement that, is I would pop my head into her office door at the beginning of the day, say hello. And if I saw people on my schedule that I knew were fairly complex and she had grand plans for, I would say something like, hey, if Mrs. Eraser's blood pressure is not down when she comes in today, did you want to add this, or did you have another plan? And I would make sure to suggest something so she would know like I was thinking it through, and I would tell her what I was thinking, but she could suggest otherwise, and that would be totally fine. I would jot it down in their notes so I could implement it later if it was needed. This wasn't like perfect, but it worked. It kept us on the same page. And over time, I learned her style and could do this more easily. But still, sometimes it was like wonky, and I wrote complete novels for her because of this. So I had like, here's plan A. If that doesn't work, we'll go to plan B. And if that doesn't work, we'll go to plan C in the notes so that she didn't have that problem. I do have a whole video on how I took notes in primary care. You can check out that video. I will leave it linked below, and I'll walk you through exactly how I write the note. And if you want a free note template for nurses and NPs, you can actually check the link below. I have both of those. So how do you kind of like bring that up in an interview? Just ask, honestly. Will I have my own panel? If so, will I also see acute visits from everyone? If I won't be having my own panel, how will I be collaborating on a plan so that the care is unified? Questions are not the enemy here, and I hope you're getting this as we kind of go on. Just be bold and ask them. The practice owner will love that you're invested and you've really thought this through. And if they don't love it, that's a red flag and you can leave. Next, office managers. Do they have an office manager? And man, I hope for your sake that they do, because coming from an office that we didn't have one, well, it was a lot. I can't imagine being the owner of a private practice and also managing it. That's literally everything from like bills to business things to marketing to customer service to, hey, the printer broke and we need to fix it. Where's the paper? Did you buy the paper for the printer? Oh, the toilet's flooding. We also need more paper and office supplies. You know, the internet's not working. What do we do about that? Oh, we have to schedule a meeting with the fire chief, in addition to having to manage your full patient panel. And if you are trying to do all of the things, the practice is probably going to run a little slower than is ideal, just because there's so much going on. So scope that out a little bit, friends. For me and my sanity and your sanity, scope it out. I definitely will in the future. See if things seemed organized and all of that. Like check out their desk. Is there like a mountain of paperwork that's about to like avalanche off? They might be trying to do it all and they might be struggling and they might be a little behind. Okay. Just not like a don't do this at all, but just keep it in the back of your mind. This can be awkward if you bring it up in an interview. Like I wouldn't be like, do you have an office manager or are you like overwhelmed? So instead of saying like, are you completely overwhelmed and do you cry yourself to sleep every night? A kinder way to bring that up would be to ask like what the office structure looks like in terms of the staff that work there and what support you will have with them. This will also be able to seamlessly tie in asking about like, do you have an MA? Do you get your own MA? Do you share? What is the receptionist situation? Are there additional nurses? What other potential beautiful humans are in this office that are going to make the world run? And do they have a biller? I would just ask that, because goodness knows we're not taught how to do that well enough. P.S. But if you do need a billing and coding course, I will leave one link down below by Skills on Point. It's like $20, I think. Changed my life. I was like, well, this needs to be everywhere. It's so helpful. Okay. And the best for last is flexibility. Private practice is usually very flexible in many ways. Since it's not a giant corporate office, you can actually like know your coworkers, and usually they are people that help when life happens. I found that in my experience and the experience of friends who have worked in private practice, I had a much easier time in terms of like not having backlash when I needed to suddenly leave to pick up my suddenly puking child from daycare, or if I was late because my car decided that it wasn't going to start, or I ran over a bunch of nails on the road because we were in a new development and there were just nails everywhere. Like it was, you know, obviously you want to be as reliable as humanly possible, but life happens. And it was much more like, go with the flow and we will figure it out, and less like,
how dare you have a life outside this job and you don't take an airplane to work.
Like less that vibe. The latter was the vibe of a lot of giant healthcare systems I worked at previously. In case that wasn't obvious. They're like, well, you can't leave, your kid's puking, but it's fine, you can't leave. And you're like, I don't know what to do. But in private practice, most people are pretty cool and they have everyone's back, and you just kind of like give each other favors and it works. Unless they're just manipulating you, in which case you should leave. The flip side of this though is that not everyone is like this, and not everyone will have your back, and then you're really stuck because there are like 4 people in the office, and if there's one bad apple, that makes a crappy ratio of apples that you like to talk to and apples you don't like to talk to. And that was a really terrible analogy, and I should not be allowed to make analogies anymore. Anyway, moving on. I'm tired. Along with life flexibility, you can usually also be flexible with appointment times. And friends, I cannot tell you how huge this is. I know we touched on it a little bit earlier, but I had so much more flexibility in terms of how much time I got to spend with my patients, because that was my boss's primary reason for leaving a huge health system, was she wanted to spend more time with the people who needed it. And that's a very common theme that I've seen in private practice. So she prioritized that. It's just less of a grind and less of a numbers game. No one in corporate is telling you that you aren't seeing enough patients and you need to do more procedures, like as if you can decide if are we going to just start chopping into people now? Obviously, you do need to make see enough patients to make it financially work, but there was just less scheduling madness and it was more easy to work things in. In your interview, you should definitely ask about patient appointment times, and if there's any flexibility with that. I have found that private practice really wanted me to succeed, and they were usually pretty willing to work with me to keep the office smoothly, giving me, hours, admin hours to get stuff done. They didn't freak out at you if you asked a question. And when you're asking these questions, if they're like, nope, like rigid 15-minute appointments, like maybe that's just not the job you want. And that, my friends, is it. There are my big things to look for when you are thinking of working in a private practice in primary care, especially. If you work in private practice, I would love to hear your thoughts and experiences with them. So leave them in the comments below. Let us know your specialty as well, so we can get a frame of reference. Good luck with your job hunt. And remember that you can do hard things like interviews. Interviews are hard, but you can do them. You've got this. Let me know how they go. Bye, friends. See you next time.